This liquid medication contains a combination of B1, B2, B3, B5, B6, iron, Met, and Choln. It is used to treat or prevent vitamin deficiency caused by a poor diet, certain illnesses, or during pregnancy. Vitamins are essential for the body and contribute to overall good health. It is important to take the recommended dosage daily at the optimal time for the best results. Remember to take this B1-B2-B3-B5-B6-Iron-Met-Choln liquid exactly as directed by your doctor or as stated on the product package. Do not take more than the recommended dosage. It's important to use a medication measuring device to carefully measure the prescribed dose, and avoid using a household spoon. Some products are best taken on an empty stomach, either 1 hour before or 2 hours after meals. If you experience stomach upset, you may take this medication with food. However, it's important to avoid taking antacids, dairy products, tea, or coffee within 2 hours before or after this medication to ensure its effectiveness. Always consult your doctor or pharmacist if you have any questions about the use and timing of this medication. If you experience constipation, diarrhea, or an upset stomach, these effects are usually temporary and may go away as your body gets used to the medication. If any of these effects persist or worsen, inform your doctor or pharmacist right away. Iron may cause your stools to turn black, but this is not harmful. If your doctor has prescribed this medication, it means that the benefits outweigh the risks of side effects. Many people using this medication do not experience serious side effects. A severe allergic reaction to this drug is rare, but seek medical help immediately if you notice any symptoms such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects, contact your doctor or pharmacist. In the US, call your doctor for medical advice about side effects. You may also report side effects to FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, call your doctor for medical advice about side effects. You may report side effects to Health Canada at 1-866-234-2345. It's important to keep B1-B2-B3-B5-B6-Iron-Met-Choln liquid out of reach of children, as accidental overdose of iron-containing products can be fatal for children under 6 years old. If an overdose does occur, seek medical help immediately or contact a poison control center. It is important to talk to your doctor or pharmacist before taking this B1-B2-B3-B5-B6-Iron-Met-Choln liquid if you have any allergies or medical history of iron overload disorder, alcohol use, liver problems, stomach/intestinal problems, or vitamin B12 deficiency. Liquid preparations of this product may contain sugar and/or alcohol, so caution is advised if you have diabetes, alcohol dependence, or liver disease. It is also important to inform your doctor about all the products you use before having surgery, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant or breastfeeding, consult your doctor before using this medication. It's important to be aware of potential drug interactions when taking B1-B2-B3-B5-B6-Iron-Met-Choln liquid. This product can decrease the absorption of other drugs, such as bisphosphonates, levodopa, penicillamine, quinolone antibiotics, thyroid medications, and tetracycline antibiotics. It's important to separate the doses of these medications as far as possible from the doses of B1-B2-B3-B5-B6-Iron-Met-Choln liquid. Be sure to ask your doctor or pharmacist about how long you should wait between doses and for help finding a dosing schedule that will work with all your medications. In addition, this product may interfere with certain lab tests, potentially causing false test results. It's important to inform lab personnel and all your doctors that you are using B1-B2-B3-B5-B6-Iron-Met-Choln liquid before undergoing any lab tests. Remember to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. And, as always, do not start, stop, or change the dosage of any medicines without your doctor's approval. If someone has taken too much of this medication and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek medical help immediately. In the US, you can call your local poison control center at 1-800-222-1222. In Canada, you can call a provincial poison control center. Symptoms of an overdose may include stomach pain, nausea, vomiting, and diarrhea. Narration: it's important to follow your doctor's prescription and not share this medication with others. Your doctor may also recommend lab tests while you are taking this liquid, such as a complete blood count and checking your vitamin B12 levels. It's important to keep all your medical and lab appointments. Remember, this medication is not a replacement for a healthy diet. Make sure to maintain a well-balanced diet, including foods rich in iron like red meats, especially liver, fish, beans, dried fruit, and iron-fortified or enriched cereals and bread. If you happen to forget a dose, simply take it as soon as you remember. However, if it's almost time for your next dose, it's best to just skip the missed one. Make sure to take your next dose at the regular time and do not take a double dose to make up for the missed one. Be sure to keep B1-B2-B3-B5-B6-Iron-Met-Choln liquid at room temperature, away from light and moisture. It's important to store it in a safe place, out of reach of children and pets. When it's expired or no longer needed, make sure to dispose of it properly. You can ask your pharmacist or local waste disposal company for guidance on how to do this. And remember, never flush medications down the toilet or pour them into a drain unless specifically instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.